95% of the patients actually develop cataract because of aging.
Aging. Now, is this a part of aging or even young people can get cataract?
Kids of even 1 month, 6 months, 1 year can also develop cataracts. But they are.
So, Dr. Mandeep, then what are the signs and symptoms of this cataract so that it can be identified early by the general population?
People come to us when they stop seeing the peripheral objects while driving, and that's very risky.
Both the eyes affected same time, or is it like
The cataract formation is very, very early in 40s. You will have a young guy in 40s, 45s coming with bilateral cataract.
is it very painful surgery, or what happens after the surgery? Is the recovery?
This is a question everyone wants to know. You lie down, there is a microscope on top of you. You see 3 cold lights in it. You just need to keep looking at it. In between, you feel that your vision is going off. It's darker now.
What are the complications of the surgery?
We do a surgery for the right eye, and once the vision gets cleared in the right eye, he says, "Oh, now I'm starting to have problem in the left eye."
But in your experience, have you seen both eyes getting affected at the same time? Is it common, or is it not described?
I'm Dr. Mandeep Lamba. I have an experience of almost more than 2 decades in ophthalmology, cataract surgery, and retinal surgery. So as we take this podcast ahead, we will try to clarify what cataract is all about, and that is the point of focus for today. I'm trained from Chennai, India, Dr. Agarwal's Eye Hospital, which happens to be the world's largest chain of standalone eye hospitals today. I have been working in Agarwal's Eye Hospital for almost 15 years. First in Chennai, then as a medical director in Hyderabad. And it's been a decade since I've been in UAE practicing and sharing my experiences with patients and making sure they benefit out of my experience in the field of cataract and retinal surgery. You can reach me on drmandeeplamba.com for more information about me.
Dr. Mandeep, can you tell us what exactly is cataract?
Just to make things very simple and give you an analogy, Dr. Amitabh, imagine I like a camera. All right, you have a shutter which is called as cornea, which filters the abnormal light to go inside the eye. You have pupil, which maintains how much light can go inside.
Yes.
So when you are in a dark ambience, your pupils are bigger, so that excess light goes inside.
Right.
When you are in a let's say bright room, the pupils are very small, so that they can restrict the amount of light that goes inside.
Right.
Behind this iris, you've got lens. Okay, and this lens, imagine it like a bag of protein. It has a capsule around it. Inside, it's filled with natural protein.
Yeah.
And over a period of time, predominantly because of aging, certain portions of this protein undergo denaturation.
Yeah.
So if I can explain it to you, denaturation is something which happens if you boil an egg or fry an egg.
Correct.
You know, the part of the egg which actually comes in contact with the heat early, undergoes denaturation and it becomes white.
Yeah.
So something similar happens with the lens. The protein inside the bag tends to start becoming opacified, starts obstructing the light to go inside the eye. Now, actually, the light is supposed to hit the lens, and lens focuses this onto the retina,
Right.
and it should form an image onto the retina. But unfortunately, in cataract, the interruption in the light penetration to the eye starts happening,
Yeah.
and that leads to defocus, that leads to vision disturbances. Now, which part of the lens is going to get affected, it decides how much problem a patient will have. That's in a nutshell how cataract affects your vision.
Yeah. So got it. So you mentioned somewhere aging. Now, is this a part of aging, or even young people can get cataract?
Predominantly, cataract is associated with aging.
Okay.
95% of the patients actually develop cataract because of aging, because of no other known factors, but that's not a rule.
Mm-hmm.
We see cataracts right from a newborn until any age you see. When I started my career as a student, I remember we used to always say that cataract means anyone with 65 plus can have cataracts. That's not a rule now. Because of the lifestyle that we have, diet that we have, screen use, phototoxicity.
Oh.
We are seeing cataracts and their age is actually average age sliding down to around 45 to 50. So every now and then I've got a patient at, let's say, 45 to 50 who's got a genuine cataract and he comes to us.
Yeah.
There is a complete different entity called pediatric cataracts for various, in response to various insults in intrauterine life, certain metabolic disorders which mother suffers from, or genetics. The kids of even 1 month, 6 months, 1 year can also develop cataracts, but they are rare. To share with you, Dr. Amitabh, we had a patient last week. We operated her. She is a 98-year-old Swiss celebrity. Case was really challenging because the tissues at that age, 98 years, we're talking about, acts in a very, very fragile manner. So cataract surgeries can be done at any age. We're talking about from the kids to up to 98 or 100 years as well.
So, Dr. Mandeep, then what are the signs and symptoms of this cataract so that it can be identified early by the general population?
So you can broadly divide these signs and symptoms into early, mid, and late cataracts. If you say early cataracts, the first sign is frequent change of glasses.
Okay.
Frequent change of distance power. So if you're wearing a minus power glass, let's say you're -3 right now, you go to a doctor, he says, no, now you're -2.5, 6 months later you're 2. This kind of shift actually shows that either you have got cataract or in certain cases glaucoma. But a good ophthalmologist will be able to differentiate between what exactly you have.
Now this change of power is like same across all ages or any particular age you are talking about?
No, so it can happen to any age, as we discussed. It can start from 40 onwards, and even in younger population, and drift can be from any side to any side.
Okay.
So a minus powered individual can become more deeper myope or more increase in the power. Sometimes patients at 50s come to us and they say, doctor, my eyes are becoming better now.
Better. Okay.
I was wearing -4
Yeah.
and you check my eye, now you're saying I need -2 glasses.
So that may not be
It's
a
a
good
good
sign,
news.
yeah.
It's not always a good news. So there is something happening. Most likely the density of the lens starts to increase because of the cataract, and now it's actually forging the light much more acutely onto the retina, and that leads to change in the glass power. So that's not always a happy news.
Yeah. So viewers, please with the expert related to that. Now another question. Yes.
So following this, the next range of symptoms are going to be blurriness of vision, seeing halos around the eye. Typically in UA, people come to us when they stop seeing the peripheral objects while driving, and that's very risky.
Okay.
You need your peripheral vision when you're driving. You see a car coming from the side, your peripheral vision reads it, then you look at the car and then you brake and you decide what needs to be done.
Okay.
Imagine if your peripheral vision is restricted, that puts you at risk to develop, get into accidents and hurt yourself or someone else.
Yeah.
So that's one of the factors, again, related with cataract. In advanced stages, of course, the vision drops so much that a person cannot do its day-to-day activities as well. Yeah.
So are both the eyes affected same time, or is it like one by one or one at a time? Why does that happen then?
Right. So as a rule, one eye follows the second eye. You will develop cataract in one eye, and other eye would just be following the other eye.
Okay.
The first eye, I mean to say. So typically what happens is patient comes to us and he says that, doctor, I'm not seeing with the right eye. I've got problem in the right eye. We do a surgery for the right eye, and once the vision gets cleared in the right eye, he says, no, now I'm starting to have problem in the left eye. There's no connection.
It's not an infectious or contagious.
It's not an infectious thing. It's just that he was relying on the better eye. Yeah. And now once you've removed the cataract in the bad eye, that eye becomes a good eye. And then which was previously your better eye, now becomes a worse eye. So we always tell our patients that this is what you're going to experience. And it's very, very rare that only one eye gets affected. And when you have only one eye getting affected, then you need to look into certain secondary causes.
But in your experience, have you seen both eyes getting affected at the same time? Is it common, or is it not described?
No, it's not a rule. It can happen in both eyes symmetrically also.
Okay.
Absolutely.
Okay. Thank you, Dr. Mandeep, for this simple explanation. Now, what are the risk factors in which patient you, or which are the people who are at a higher risk for developing whether diabetes, blood pressure, or any industrial exposure or work profile? Does that put them at a higher risk for developing?
Yes, absolutely. So we are coming to basically causes that lead to cataracts. One of the most common cause is aging.
Okay.
Uh,
Yeah.
just age-related denaturation of the protein.
Mhm.
Just what happens in your skin, your hair, your other body organs.
Right.
That's the most common cause. And then you have got secondary causes. Secondary causes can be genetics.
Mhm.
I mean, if your parents have had it earlier, there is a chance that you will also have it very early in your life.
Mhm.
Uh, metabolic factors, because when I'm talking about the lens, the bag, it is surrounded by fluid in front, which has nutrients, glucose, everything. And behind you've got gel, which is called as vitreous, which has got nutrients, electrolytes, glucose, and any kind of hormonal fluctuation actually affects the content of the protein.
Mhm.
It affects the viability of the protein. So metabolic disorders like hypertension, diabetes very prominently, hyperthyroidism, hypothyroidism,
Okay.
parathyroids, abnormality of parathyroidisms, and any other metabolic disorders, even if you have had a prolonged hospitalization with electrolyte imbalances, can affect the lens and can create cataracts very early in life.
So if we discuss so many risk factors, so can it really be prevented by any measures, or if it has to happen, it will happen?
Right, so when it is age related and genetically mediated, it has to happen.
Something that we cannot fix now, I can understand.
Exactly.
But something like a diabetes or electrolyte imbalance.
Absolutely.
Yeah.
So if you have a good control of diabetes, I've
Mhm.
got patients who were diabetic for 30 years now,
Mhm.
and they have absolutely clear lens because they've had a good control on diabetes.
Right.
And we see this in terms of their eye pressures, lens, retina, everything. So we are not talking about that right now, the whole plethora of diabetes, how diabetes affects eye. But a good control of diabetes plays a significant role. Again, anything that affects your metabolism, if you're good and healthy with it, for example, cigarette smoking, alcoholism, industrial exposure to excess light. Now, cataracts are very commonly seen in people who work with sharp lights.
Mhm.
For example, industrial workers. Trauma is again a whole different scenario. Trauma leads to cataract very early, and we see a lot of patients with industrial traumas coming to us with early cataracts.
However, something like diabetes or electrolyte imbalance or industrial exposure, trauma, medicines, so many things are there which we have full control on.
Was one very interesting findings. I
Mhm.
used to travel to Mauritius.
Mhm.
If you know, Mauritius is an island nation in middle of Indian Ocean.
Yeah.
And we had discussions because I used to go and do the surgeries there,
Mhm.
and I noticed that the cataract formation is very early in Mauritius.
Their population.
Let's say 40s, you will have a young guy in 40s, 45s coming with bilateral cataract. And we had certain forums there to discuss the health of Mauritian
Mhm.
population. It came to my light, and one of the endocrinologists told me that it happens because it's proven fact in response to the cortisones which your body acquires from the food stuff, because they don't grow anything other than sugarcane.
Understood.
Everything is imported.
Right.
Your vegetables are imported. Your meat is imported. What you drink is imported. There's very high alcohol culture
Yeah.
in those societies.
Mm.
So all these things lead to
Increased cortisol.
and that leads to all kinds of eye problems, especially cataract as well.
Yeah.
Something similar I see in Marathi population also.
Mhm.
We do rely on our food stuff being imported,
Yeah.
and we know that antibiotics in food stuff, cortisone in meat is very detrimental in various ways.
Thank you very much for the clarification. So now, once a cataract is diagnosed, it is confirmed that he has a cataract. um, how do you decide the timing of the surgery, or how do you decide whether patient should undergo a surgery now?
This is a very, very interesting question, Dr. Amitabh, and many patients ask me, when should I do the surgery?
Yes. Yes.
Answer is in one line. I, as a surgeon, educate you that you've got cataract, diagnose you, and treat you. But I don't decide when surgery has to be done.
Okay.
It's a patient who decides when surgery has to be done.
Mhm.
When you start feeling that your day to day activities, your quality of life, your work is getting affected, that's the time you should get the cataract surgery done. Vision drop because of cataract is absolutely reversible, but that doesn't mean that you keep delaying this, okay, till eternity.
Okay. Okay. Yeah, got it. Got it. So patient can decide
Patient
about the
decides,
surgery.
absolutely.
Yeah, interesting. So then, is it like a routine surgery, like or major surgery? What category do you categorize into it?
Well, see, the precautions which we take norm-wise is actually of a major, mid-duration surgery,
Okay.
but it is actually a very easy surgery.
Mhm.
In experienced hands, it takes 10 minutes,
10
not
minutes.
more than 10 minutes.
Wow.
All right. Some of the times patients don't believe us that how can you do a surgery? You can go inside the eye, do something, then come out in just 10 minutes.
Yeah.
But that's all it takes, and they're always surprised that they underwent this procedure.
So,
Although the process,
Mhm.
just to make sure that those 10 minutes, nothing goes wrong,
Mhm.
patient has a good post-operative recovery,
Mhm.
good intraoperative experience, that process is very healthy and it's time consuming.
So I think probably with experience now you will be able to finish it in 10 minutes. So maybe experience counts in such surgeries.
Yeah.
Definitely. So then is it very painful surgery, or what happens after the surgery? Is the recovery faster? How long
So
does it
you will be surprised, and your viewers will be surprised when I say that 95% of the cataract surgeries are done without using any invasive anesthesia. I'm repeating this, we don't use any anesthesia except for eye drops. So just before I'm about to go inside your eye to do the surgery, we just use 2 drops of topical anesthesia so that you don't blink and you should not have an irritation when we touch your eye.
Right.
That's all it needs.
Yeah.
There are exceptions, which are like 5%, but those patients are educated before. These are secondary cataracts, high risk cataracts, where we tell them that we are going to give you a local anesthesia. We give an injection.
Okay. Okay. Yeah. So that is very reassuring to know that it's not a very invasive anesthesia, a shorter surgery, and probably a faster recovery in most of these cases. So what should patient expect after surgery? The vision should be completely normal, or they still have to use glasses after surgery?
Okay, before we move to that point, I'll just interrupt and take you a bit back, because many times patients ask me, what will I feel during the surgery?
Correct.
Okay.
Okay.
So sorry to interrupt you,
Yeah, no, that's very important. And you, since you have been seeing that,
because
yeah.
you're not under general anesthesia. You're conscious.
So they can
You're
hear
seeing.
everything. Yeah.
You're hearing.
Yeah.
If there is any disturbance, I'm talking to my nurse. I'm talking to my anesthetist. They can, everything.
Right.
And that can really make you apprehensive intraoperatively.
Correct. Correct.
So I always explain my patients that once you are on the table, you can talk to me.
Mhm.
In fact, there is something called as verbal anesthesia. Many times, it's not a medical term. Right?
Understood. Yeah.
So many times
just keep them occupied with
exactly.
talking. Yeah.
So you touch the eye and you see that this guy is a little apprehensive. So we just talk random thing, that where are you from, how many kids you've got, what do you do?
Yeah.
10 minutes of conversation and the job is done. And the patient talking to me does not disturb my surgery. Okay?
Yeah.
You lie down, there is a microscope on top of you, you see 3 cold lights in it.
Right.
You just need to keep looking at it. In between, you feel that your vision is going off.
Yeah.
It's darker now, and then it comes back. That's what you experience. You don't experience pain.
Yeah.
That is to reiterate.
Yeah.
Now, this question, we can have like half an hour discussion on this particular.
I wish we had. Maybe next time we can have a separate session on that. Yeah.
So, first thing is, how early can you start using your eyes? Answer is immediately. We patch the eye. We just remove the patch immediately afterwards, and you can start using your eye 10 minutes after the surgery. I mean, I can't be specific with the time, but that's what I mean. Now, glasses, when you talk about a glass prescription, there are three elements of your glass prescription: distance vision, reading vision, and then there is something called as astigmatism, which is like
Mixed one.
missed astigmatism, or let's say power on an axis.
Correct.
So depending on what a patient has, we can have the discussion with the patient before the surgery and decide what he wants.
Okay.
And it all boils down to whether he is fit to undergo that kind of procedure, that kind of process, and financially to a certain extent. All right.
Yeah.
So we've got lenses. Whenever we do a cataract surgery, the whole process is we remove that denatured protein, we maintain that bag, and we put an artificial lens inside that bag. Those lenses are different. Okay. We can just go for something called as monofocal lens. We clear your vision. You will still be wearing glass powers for the axis and for the reading, and we make sure you don't have to wear glasses for distance.
Yeah.
Or else there is something called as toric lenses, where we can actually negate the distance glass power and the axis power, but you have to go in and wear the reading power. Or we have multifocal lenses, where you can actually negate the distance and the reading, both. And then we have got toric multifocal lenses. That makes you completely glass free. It depends from patient to patient what you need,
Exactly.
what your insurance allows you to do, what you can afford, and what you want from your life.
Right.
Already, but it's one chance.
Yeah.
You can't keep redoing it.
Okay.
So you have to take that decision very critically before the procedure,
Before the surgery.
and you have to inform your doctor what he needs exactly.
Yeah. So answer to this question is very complex. Probably you will have to sit with the patient and personalize depending on
Exactly.
his preferences.
So just reiterate and make it simple. You can become glass free after cataract surgery. That is absolutely possible. And you will be amazed to know, Dr. Amitabh, that I think 10 to 15% of the cataract surgeries are actually done for the patients who do not have cataract. Now, this sounds a little fishy, but I'll tell you something. There is an entity called as refractive lens exchange. A guy who has never worn glass in his life, he turns 50, 45, 50, he has to wear a reading glass because he can't see anything near. I'm sure everyone in 45, 50 would have experienced that. He doesn't like it. And he comes to us, doctor, I can't see it. I mean, do something for us. We do explain to the patients, we do explain this to the insurance companies also, and tell them that he's got a glass intolerance. We can remove that lens and put a multifocal lens inside. He can still be glass free.
Yeah.
All right? And people are very, very happy with these kind of
So this
outcomes.
is a cataract surgery for patient without having cataract.
Exactly. So it's called as refractive lens exchanges.
Yeah. Thank you for the explanation. Coming back to the surgery, what are the complications of the surgery, cataract surgery, which everyone should be aware about? I'm sure every patient who comes to you for surgery must be asking this question.
This is a question everyone wants to know from every surgeon, not only me or ophthalmologist.
Right.
So cataract surgery, unlike most of the other surgeries, are very, very safe. The complication rate in general, not talking about experienced hands, is actually 1 in 800.
Okay.
So 1 in 800 is considered to be a very safe surgery. Chances of infection worldwide are 1 in 3,000. So that's again very, very rare chances. Common complications, if I was talking about the bag in which the protein lies. The rupture of that bag or displacement of that bag is one of the most common complications.
Right.
It has to be managed by an experienced cataract surgeon who can manage those situations, or by a retina surgeon.
How early it can happen? Immediately or?
Well, it can happen in different stages of the surgery.
Okay.
All right. So it can happen in very early stages also, and it can happen in very late. But the point is how well it is managed that decides how the post-operative outcome in the long term it's going to be.
Correct.
So fortunately, I have been blessed that wherever I have worked in my career, and even now in UAE, we have always had a standby retina setup with us. And I am trained in retina surgery as well. So a lot of patients a lot of complicated cataract surgeries are referred to me to fix them.
Correct.
So we always have a backup. In past 4 years, there was just one incident where we actually required to fix it, but we fix it in the same setting, and then the patient go out after getting his cataract fixed.
Correct.
Okay,
Yeah,
it's all about.
so friends, yes, as Dr. Mandeep correctly said, no surgery is 100% safe. There are complications. Complications are minimum in experienced hand. And as a patient, if you are undergoing surgery, it is important for you to understand what are the complications, so that it should not be coming as a surprise or shock to you later on. So we always advise to discuss with the specialist in detail about these complications. Coming back to the surgery, we also heard something like a laser cataract surgery. Is it something different, or is it same settings you can do it?
So yeah, that's another question which is asked routinely to me, probably on a daily basis. So this is called as FLACS, femtosecond assisted cataract surgery.
Okay.
Lasers are used in eye surgery very commonly. I'm sure people must have heard about LASIK surgery.
Yeah.
There are genuine lasers being used and very efficiently. Unfortunately, lasers in cataract surgery are not yet to that mark that they can replace the handcrafted surgery,
Okay.
should we put it, or a routine phacoemulsification surgery. Lasers are pretty old. I mean, I used lasers in, I think, 2011, and when I was in Hyderabad. Certain steps of the surgery can be done by laser surgery, and over a period of time, we realized that the outcomes, they don't have a better outcome than a handcrafted surgery.
Okay.
So there are few more technologies in the loophole. We don't know. I mean, my statement might change after a couple of years. We are actually evaluating a couple of more machines right now. One of them is a Swiss machine which promises to be way better than the current FLACS. And that is the reason, if you say there are very few people doing laser cataract surgeries, and even if they do just couple of steps and then finally take over as a manual surgery.
So in your experience, what percentage of surgeries you prefer doing with laser, or just a handcrafted is better?
I've totally moved to handcrafted right now.
Okay.
I'm still waiting for that technology which can replace me.
Okay.
So we tried, as I'm saying.
Not, yeah.
No, it would be. I'm pretty sure there are a lot of things on the horizon right now.
Okay.
But at this point, definitely no.